Thank you so much, Dr. Malvankar, and your team as well. Thank you so much for that interesting and a very relevant presentation. Thank you for providing some breathing exercises that we can all take away from here this evening. Yeah, we really appreciate the presentation, and we really appreciate you coming out here so much. Thank everybody else who's attending here. Thank you all for staying with us here this evening. And please continue to bear with us here now as we spotlight the question and answer panel. On tonight's panel, just to introduce you, we have Dr. Rajiv Bindlish. He will be guiding the session, hosting, I suppose. There's Dr. Catherine Birt, who we've met earlier this evening, Dr. Sydney Hutnik, who is a member of the Glaucoma Research Society Board of Directors. And from the presentation, you've already met Dr. Monali Malvankar. And if you have any questions specific to meditation, there is Belén Montefalcone as well. So thank you all for being part of the panel. Without further ado, I'll leave you to it, and I'll turn it over to you, Raj. Thank you.
Thank you. Thank you for the wonderful presentation, Dr. Malvankar, and thank you, Belén, for the breathing exercises. I actually really quite enjoyed it. Good way to kind of relax after a heavy day in the operating room. So a few questions have come in, and we'll get to those just a sec. Just one shout out for myself to Dr. Trope. He has been quite an inspiration, even for us glaucoma specialists, someone we can always rely on to give a second opinion. And the nice thing about Graham, yeah, you know, I mean, as Katie said, he was very intimidating as a medical student and as a resident, but he actually had a big heart, and he actually cared for people. And he gave some great advice, not just about glaucoma, but about life. And I think that's probably what makes him stand out from others. We're going to miss you, Graham, but thanks for staying on the board, and your contributions to the society have been, I mean, can't deny them. They've been awesome. So first question I have for Dr. Malvankar is, what do you measure as quality of life? And are there any specific quality of life markers for glaucoma patients?
Yeah, that's a very good question. So there is a glaucoma quality of life questionnaire. We use the time trade-off questionnaire, which is very commonly used to measure the health-related quality of life. And it does measure how, so it measures the overall quality of life. So it does include the happiness of the patients, because probably some of them, is again my thoughts, just by knowing that we have a particular disease, we do get a little bit anxious down the road, you know. So quality of life is just measures overall health and overall quality of life of the patient.
Okay, thank you. And just another question, how often, so just in terms of how often you should be doing the breathing exercises, is it once a day, is it twice a day?
So I'll pass on to Belén.
Thank you, Dr. Malvankar. Well, it would depend on what breathing exercises you're practicing. There are many different types of breathing practices, and each breathing technique has a different impact. So I would suggest taking the time to learn from someone that has been trained. I know there's a lot of information on YouTube and such, but it is a good practice to learn from someone that can direct you to the practices that suit you best. And they will also indicate how much you should practice and how often. Yeah.
Okay, thank you for that answer. Here's a general question, and I'll direct this to Katie. What treatment has the highest success rate for lowering intraocular pressure and preventing blindness, the holy grail of glaucoma treatment?
Quite a broad question. I think it's probably generally recognize that if you really want to get the pressure as low as possible, you need to go to surgery. And there are a wide variety of operations available nowadays, but the lowest pressures are still mostly reported with the classic trabeculectomy, which is sort of the gold standard surgery for glaucoma, for lowering pressure. It's been clearly shown that lower pressure does reduce the risk of glaucoma progression or risk of blindness. However, I'm not suggesting that every person with glaucoma needs to have surgery. We can manage a lot of people with medications and lasers that don't need to go on to an operation. When it's necessary, that's the way to go.
Okay, thank you, Katie. Just remember, whatever treatment we offer for glaucoma, it's not a cure. It's only a way to slow glaucoma progression, and you have to maintain your follow-up visits. A question for Cindy. Are there any tips to prevent glaucoma, especially for people with a family history of glaucoma?
Well, thank you for that. And I can't help but use the beginning of my answer to also say to Dr. Trope, I'm here today because of giants like you. You really, for all of us, have paved the way. Katie, Raj, and I, we've learned so much from you. And I don't know if everybody on this call knows, but you're internationally recognized and respected. So thank you for all of you've done. In terms of family history, here's the thing Raj has just said. Nobody in the world knows what truly causes glaucoma, and nobody knows how to cure it. As of now, the only thing we know how to do is reduce the risk that it'll get worse or progress. So there are a number of risk factors in glaucoma, meaning that there's not one single thing that can guide you. Just because you have an aunt or uncle that has glaucoma doesn't mean you're going to get glaucoma. It just means with a positive family history, you're at increased risk. So it's really about risk reduction. And when we talk to our patients, and I know all of the glaucoma docs on this call know this, we talk about modifiable risk factors, things that people can do to help. One of the things, meditation, reducing stress, and then there's the non-modifiable. You can't change who your parents are, you can't change your genetics, but what you can do, and I think Katie said it all, make sure that you keep your pressures at a target that is appropriate for you, and you're going to learn that by visiting your eye care professional. But as Raj just said, one of the most important things you and your family can do is go for regular eye checks. Glaucoma is known as the silent thief. It sneaks up on you. For the most common type of glaucoma, it doesn't cause pain, and you don't really know you're losing vision at the beginning because it takes your side vision away before your straight ahead vision. So I would encourage your family members as early as 40. I even have my teenage son going to see an optometrist regularly for his eye check. So being screened, regular visits, taking your IOP lowering, pressure lowering treatments recommended by your doctor, being healthy, meditation, eat well, exercise, try not to smoke. All of those things are very important when used collectively.
Yep, thank you, Cindy. I think that was really important. And as I said, just to reiterate, getting your eyes checked to see if you have elevated eye pressure or disc damage is very important. And the only way you can know that is getting your eyes checked. So I think giving routine eye exams is important. Here's a question. Is there a possibility of habit breathing in the manner to slow glaucoma? So is, I guess, Dr. Malvankar, so if you were to do this breathing, do you think it can slow the deterioration of glaucoma?
There has been studies, Dr. Bindlish, on lowering of intraocular pressure for those who practice mindfulness meditation. So there could be, it does help calm the mind down. So it does have, and there has been studies of looking at the impact, the beneficial impact of meditation on blood pressure. So it does help lower the blood pressure. And there has been recent studies looking at the impact on intraocular pressure as well. So there is a possibility that it could reduce IOP. And meditation would definitely help overall.
So just a second question, maybe I'll just ask Cindy very quickly. There's talk in the video about the cortisol levels, and do you think reducing cortisol levels, obviously we talk about that in central serous retinopathy, but what about in glaucoma? Do you think elevated cortisol levels cause high eye pressure?
Right, you know, Raj, you always ask such good questions. Yeah, I mean, if you look at all of the data, their research is really important because it's the research that guides us. You know, I always say for a lot of our diseases, we have known risk factors, but there's a whole heck of what I call unknown risk factors, things that are probably contributing to tipping that teeter-totter from a healthy state to maybe being more at risk for glaucoma. And if you look at the data, there are some smaller studies, not large prospective multi-center randomized, but that certainly do look at cortisol. We know that eye pressure for all of us normally fluctuates throughout the day, normally by 2 to 6 millimeters of mercury. And a Canadian, Stephen Drentz, through all of his studies, shows that patients with glaucoma, their eye pressures can fluctuate by 10 to 15 millimeters of mercury if untreated. And people have linked some of those normal diurnal fluctuations to circadian things that happen in our bodies, and one of those things is cortisol release. We know that eye pressures tend to be the highest in the morning for most people and tend to go down overnight, and we know that cortisol tends to peak in the morning as we wake up, but it's not true for everyone. So in answer to your question, if you look at all of the evidence of what causes disease in humans, there's no question that stress seems to contribute, but being causal, not sure, meaning because of it, it's there, but being associated, most likely, if you look at the research.
Okay, thank you, Cindy. Question for Belén, I guess. Why did the meditation start with your feet upwards? I've always started meditation with the head downwards.
This is a great question. Well, there are different relaxation practices, and today I thought it would be more appropriate to start feeling grounded and rooted to be able to then feel a little bit lighter in our body and relax the mind, finishing at the top. But you could do either way. Either way is fine, depending on the time of the day and the result that you are most looking for.
Thank you. Quick question for Katie. Has COVID or COVID vaccines impacted glaucoma progression?
I think, yes, okay. This is my relaxation, except when he's getting in my way on a Zoom call. So I think the short answer is that COVID as a pandemic definitely affected glaucoma care. People wouldn't come in, people couldn't come in. People could only come in without their family members and support and translators and what have you. Operating rooms were closed, treatments got delayed. So I fear that a lot of people were affected by COVID in their glaucoma control in an adverse way. I'm not aware of any particular evidence that the vaccines have had any impact on the disease, but certainly the vaccines have made society open enough that we can now start our treatments again. So from that point of view, they've done nothing but good.
Okay, thank you, Katie. We'll just answer a couple of more questions here. One question is, and I can probably answer this one. I've been using glaucoma drops for several years, and usually at the same time. However, if I take it an hour earlier than normal, is that okay? And you mean, generally we like to be consistent with taking your medication. However, I mean, taking it an hour earlier, an hour later is better than not taking it. So you mean, try and maintain your schedule as much as possible, but you mean, it's better to at least apply the medication as opposed to missing it. So I don't think on a one day off type of a situation, it's going to make a tremendous difference.
There's an old saying, Raj, that I often use when people ask me that question. It's better late than never. Exactly.
That's what I basically say.
Yeah.
So, you mean, just use it. it doesn't matter if it's an hour earlier, an hour later, just make sure you use your medication. There was a question about sort of ways to control eye pressure. I think we kind of answered that. It's usually drops, laser, or surgery. Those are different ways, and there can be any combination of that that's kind of used. Another question, which I know a typed answer was given, was just a concern about the breathing raising eye pressure. So I'm just going to pose that question slightly differently. I know we talk about certain yoga positions can raise eye pressure, like a headstand or a downward dog. What do you think about the breathing techniques and their impact? Either Belén or Dr. Malvankar, if they could answer that one.
Should I go or? Okay. Thank you, Dr. Bindlish. It's a great question. And this is why I highly encourage you to learn breathing practices with a trained instructor, because there are certain breathing techniques that can increase the internal pressure. So if you have glaucoma or uncontrolled high blood pressure, or are expecting, or you've recently undergone a surgery, then these are not the best breathing practices for you. But luckily there is a wide variety of breathing techniques, and there are many that you can benefit from in a safe manner.
Okay, thank you very much. And I just think for that one patient, just consider that it could be just your glaucoma worsening, which can happen. And that's why we keep seeing you back regularly, as opposed to thinking it's directly related to these breathing exercises. I think we're going to wrap up there. We usually wrap up the meeting at around 8 or 8:15. It's 8:23. So I'd like to thank you for attending and staying right to the end with the question and answer. There are a couple of unanswered questions. We can maybe answer those on their own, and some of those can be posted on the website. So I'm just going to turn it back over to Jim for final comments. Once again, thank you to all our generous supporters. Supporting the Glaucoma Research Society Canada is a great thing, and you're helping us hopefully one day find a cure for this blinding condition. Thank you very much.